Hi, everyone. This is Mayor Shawyn Patterson Howard, and we are here for Sundays with Shawyn. We're going to have a conversation about community and COVID and just give a few community updates. We are asking you right now to please share the video. Please share this video. We're going to wait for just a few seconds for people to come on in as we are preparing to go live, and we are live right now, but we are just waiting for people to come in to this session, and we will get started. Tonight we have the incredible, the wonderful, the remarkable, and always on point Cynthia Turnquest Jones, who is a resident of Mount Vernon, but who is also an educator in New York City. She's a community activist. She produces the Girls Who Learn event each year. And Sin, I guess we're going to have to do an online version. Yes. We're going to have to do an online version this year to make sure that we're still reaching out to our ladies. She is also my soror in Delta Sigma Theta, my sister in Christ, just an incredible person. So Sin, I'm glad that you are here with us today.
Thank you for having me. I'm setting up my my live right now.
That's what I'm doing. So everyone, we're asking that you please take out a moment to share this live. We're going to be starting in about 1 minute. We want to just give people an opportunity to get live and get on this broadcast.
You need like a little music right in this part.
A little music. Okay. Okay, we're getting ready to start, guys. Here we go. So we want you to know that we're going to do some updates in the first half of the show here, but we will be answering questions. So please, people, if you have questions, please put them in the comment section so that we can answer your questions tonight. We've had in the past Sundays with Shawns and updates, we had a lot of guests who were speaking and were giving information, but tonight we really, really want to hear from you, and we want to be able to respond to any questions that you might have. So we're going to get started right now. So again, we are here with Cynthia Turnquest Jones. She is a resident of Mount Vernon. She is an educator out of New York City, and she is an activist here in not only Mount Vernon and Westchester, but really the tri-state area. She produces an event annually called Let Girls Learn Day, and she does so many projects around education, strengthening young women, strengthening the community, and ensuring that we have equity and social justice. So Sin, welcome. Welcome.
Hey, how you doing?
I'm doing well, and yourself?
I'm all right. I'm all right.
You're doing all right?
Uh-huh. I'm just writing down some notes, you know, it's a good thing.
Okay, so I'm gonna just, everything is doing okay. Happy Deltaversary, sis.
Oh, thank you so much. Thank you so much.
Deltaversary today.
To my Sands, happy Deltaversary, Westchester Alumni Chapter.
That's right. So we're gonna start out, we're gonna start out with some COVID updates, Mount Vernon. Back in the beginning of March, everyone was looking for numbers, and we continue to provide you with numbers. And I said, stop getting stuck on the numbers, because we have much more numbers than what's being shown, and that is still the case. As of yesterday's report from the state and the county, Mount Vernon has 1,940 confirmed cases of COVID within our 4.4 square miles. 1,940 cases of COVID. We know that there are still 9,000 cases in Westchester that do not have addresses attached to them. And because we're about 11% of their confirmed cases with addresses, we're going to claim about 11% of those unconfirmed addresses and say potentially that we have another 900 cases of COVID. So we are, really rapidly pushing in on this 3,000 number. And being someone who's worked in public health for over 30 years, for every case that we are aware of, there are always 2 to 3 more cases that we are not aware of because people have not yet been tested. And that's where we are with the numbers right now. The Mount Vernon Neighborhood Health Center's COVID testing center came online. It's been online for a full week now. On Friday, we saw over 80 people, about 80 people being tested. And as I had stated about a week or two ago, that we were seeing clusters developing throughout Mount Vernon in apartment buildings. And I really need people to pay attention to this piece. When I say clusters, we're talking about 5, 10, 15 cases or more. And so in some buildings, we're seeing 5 cases. In other buildings, we're seeing 10. You know, there are a few buildings now that we're seeing as much as 15 cases. And that's real, and that's very serious, and that's important. Why is it important? Because again, for every case that we're aware of in a building, there's probably a few more cases that we are not aware of. And the county of Westchester, let me be clear, this is not unique to Mount Vernon. This is not unique to Mount Vernon. Mount Vernonites, we have a tendency to say, oh, Mount Vernon is so messed up. This is not unique to Mount Vernon. This is so widespread that the Westchester County Department of Health actually just put out some education, yes, Malcolm, you could put up that graphic for the county clusters. So what Westchester County has realized, and they've put out the information, and this is the flyer, that they're asking for people to do social distancing even within your buildings. People feel like once I walk into my building, I'm home. And they start putting their guard down. So the guard that they might have up when they're in the supermarket or when they're on the train or some type of public transportation or in a pharmacy or some other essential business, when they're in their apartment buildings, they begin to put their guard down. And that's a real issue, and that's a real challenge, because the lobby of your building, an infectious area, the elevator, the staircases, the mail room, any of the common areas, if you have community rooms within your buildings, if you have fitness centers, your laundry rooms within your buildings are all places, the hallways, the garbage chutes, any door that you have to open or close. These are potential points of infection within your building. And so we need you to understand that even when you get into your apartment, if there are people who are going in and out of the apartment each and every day to go to work, they're essential workers, or they're going to stores, they can potentially bring infection back home. So you have to be careful to even socially distance and use precautionary measures even within your apartment unit itself. You know, when it comes to elevators in your building, try to avoid riding in the elevator with people outside of your family. When you come outside of your apartment, before you hit your hallway, put your mask on, put your gloves on, because if you are going to ride in the elevator with someone, if you are going to push the elevator buttons, if you are handling the doorknob to the garbage chute, room and the trash compactor room, or you're going downstairs to do laundry, you still want to make sure that you're being safe. Don't congregate with others in the lobby. You know, we feel so isolated within our apartments and our houses now that when we get into our lobbies and we see some of our friends and whoever, we're like, hey, how are you doing? And we let our guards down and we get close and you know, we start communicating and chatting. We want to be friendly, but you want to still maintain a physical distance and continue to use precautionary measures. And the other thing is, if you get sick, if you find out that you are symptomatic, then, you know, call your doctor, go get tested, call the testing center. And I'm going to put this number out a few times today. Mount Vernon, we do have a testing center here. And so if you need to be tested, you can call 1-888-364-3065, 1-888-364-3065. Our testing site here in Mount Vernon is at the Dole Center at 107 West 4th Street. It is not just a walk-in. You can't just drop in. You must have an appointment. You have to have an appointment in order to be tested. And the number I gave you, 1-888-364-3065, is the state testing number, you know, that you call into and you get an appointment. And there, Malcolm has put it on the screen, 1-888 364-3065, not the Dole Center, the Mount Vernon Neighborhood Health Center. I'm sorry, the Mount Vernon Neighborhood Health Center, 107 West 4th Street, Mount Vernon, New York. That is where our testing site is. Okay. Cindy, you have anything? You want?
I have, so I know of a couple of individuals who are physician assistants and doctors who are on call,
Yes.
where they are doing virtual medical services, where individuals are able to call in regards to that, and have questions.
Yes.
And they are helping them via telephone. So that number that you gave, that is doing the same thing?
So the number that I gave is the testing hotline. It's part of the New York State Department of Health Testing Call Center. So if you call, they will ask you a series of questions about symptoms that you might be having or potential exposure that you've known that you've had to someone who is COVID positive. They'll assess you. And, if you meet certain guidelines, then they will schedule an appointment for you to go to the Mount Vernon Neighborhood Health Center and be tested. But there are a lot of companies right now that are using telehealth practices. And that's really what you're talking about.
Yes.
A lot
Yes.
of doctors' offices, their private offices and different centers are doing telehealth, where they're able to kind of look at you, get an assessment, listen to you breathe, get a visual on you, have a conversation like you and I are having right now.
Yes.
Because sometimes it's that visual. You can't tell everything over the phone, but when the doctors are able to see people and kind of have that conversation, it takes away what feels like an impersonal encounter and allows people to feel more personally connected to that physician and share the information with them.
How do you know approximately how long the telehealth has been around, or is this like popping up because of the coronavirus?
No, telehealth has been around for a few years. It, probably about the last 2 years, it's become even more popular during this time of COVID, especially with doctors kind of not wanting people who are symptomatic to come into the office. This is another way that they can kind of see them without physically being close to them. And we're going to ask everyone, just please take a moment to share this video, start a watch party on your page. We want to make sure that we're getting information out to the community. So please share the video or start a watch party on your page and make sure that you're putting questions in the comments, because after we give information, we want to start answering your questions. People have, continued to talk to us about, we got a few phone calls that I went on Friday at the end of the day. People are reporting, they said, Burger King over on Columbus Avenue, no one on the staff who are working there are using masks. And so one of the things that we did is we went over, the police department, of course, went over first to check it out. Our incident command also went over to have a conversation, and I went over and we spoke to the manager, and we helped to explain to the business that the cost of doing business in this era of COVID and ensuring that they are in compliance with all state health laws and our local laws is they must wear masks. And so they were able to get some masks. But I have to tell this to the residents. No fast food place is necessarily essential. People say, well, you need to shut this one and you need to do this. Our police force, our fire department, our Office of Emergency Management, we're still running a city. And so we're not going to sit there and be in stores all day just guarding stores to make sure that people have on masks or don't have on masks. So if as a consumer, you go into a store and you see that they are not practicing, essential business practices like social distancing and wearing masks, then please, at that time, what we need you to do is to make a report and call over to Mount Vernon Police Department, and you would call 914-665-2521, and you'd speak to the desk boss, 914-665-2521, and make a complaint. Make us aware of something that's happening. We're just, there are hundreds of businesses in Mount Vernon, and we don't just have someone standing at the door to each of these businesses to know if they are not doing what they're supposed to do insofar as masks. So we need the community to be our eyes and our ears. So if you see something, say something. Don't just come on Facebook and hit us. You can pick up the phone and make a phone call, and we can dispatch a car over there to address the issue and make sure that our residents are safe. We do have the ability to give businesses fines. We do have the ability to give them violations of city ordinances. And we, have some ability to even potentially shut a business down if they are really outside of their operations. Other businesses that are still not supposed to be open yet. So let's be clear, nail salons, beauty salons, barbershops, tattoo parlors, massage parlors, all of these non-essential businesses are still closed. Again, we don't need word on the street. Someone texted me yesterday and said, oh, I heard that from another person that there might be some beauty salon or barbershop that's open. I said, well, can you get that person to give you the address? So again, we can dispatch someone out to make sure that that business is not operating and that they are shut down. So if you see a business that is not supposed to be operating, again, call 914-665-2521. That's the police department, 914-665-2521. Do not, and I will repeat, do not use 911 to report anything like this. We have enough 911 incidences, and this is not a 911 incident. And that's why we're giving you a special number to call direct to report those type of concerns.
So Shawyn, so I want to talk about the Burger King thing, right?
Mm-hmm.
I don't want to necessarily talk about individuals not having masks on inside of Burger King. I want to talk about the mere fact of individuals going to Burger King, right? And so we're talking about, we're in a time right now where we can actually change our health. Mm-hmm. Is and news wise and things that we've read has constantly spoken about the way that we eat. Mm-hmm. And how individuals may be compromised more so when they get the coronavirus because of obesity or their eating habits and things of that nature. Mm-hmm. Right. And so all of that go into shopping. Right. So I'm going to go into shopping. And so when you said that when you live in a building, apartment building, and you're coming out and you get on the elevator, many different things, there's another thing that you need to do also when you go shopping. So when you're shopping, you have to make sure that you have on your mask and you have on your gloves. That's one thing. Mm-hmm. You also need to make sure that you discard your gloves the proper way, because you're seeing a lot of gloves around
on the street.
And on the street and things of that nature. Mm-hmm. But you also want to make sure that when you get home with the items that you purchase, that you wipe those items down.
Absolutely.
Before you actually bring them into the house. Mm-hmm. If you notice now at grocery stores, if you bring your bag with you, they will not touch your bag. You know, right. How the new mm-hmm. law was where we had to bring our bags in. Mm-hmm. Right now, they are not touching anyone's bag that they're bringing in.
You have to bag your own groceries.
They have brought back the plastic bags. Fairway mm-hmm. has plastic bags back up again, and that is because of what's currently going on. Mm-hmm. And so you have to make sure that you are also wiping down your bag when you finish with it, and you're wiping the groceries that you can wipe and that you're washing. Yes. Your fruits and vegetables and things of that nature when you're bringing it in. And so
we have to use every precaution that is available to us. In the beginning of, hearing about coronavirus, we used to hear the term constantly, we're using an abundance of caution. We're using an abundance of caution because we didn't know what was out here. Now that we know what's out here, we have to continue to use an abundance of caution and make sure that when anything that we're bringing into our house, when we come back into our house, are you walking, are you wiping off your shoes? Are you disinfecting the bottom of your shoes? Are you disposing of your gloves before you even come into your house if you have a garbage outside? Do not throw them in the street again. And that's not just happening in Mount Vernon, that's happening all over the country. You hear people talking about not throwing gloves in the street. There are a lot of stores that even have receptacles right outside of the store
Yeah.
right now for you to be able to throw your gloves in those receptacles.
And
Make it
signs.
easy, and signs. So, you know, there,
Signs out right now.
we have to be responsible as residents and a community. We don't know how long all of these changes and these precautions will have to be in place. And so we, you know, we're no longer at the beginning of this. And we're definitely not yet at the end of it. So we need to develop better sanitary practices in everything that we are doing. So we have some questions here. It says, good evening. Can you please share your thoughts on how the city will be able to recover economically from the damage that will undoubtedly experience as a result of the shutdown? I mean, look, Mount Vernon and every community around us and communities across the country, we all depend on parking revenue. We've suspended parking tickets, so we've lost that revenue. We have the businesses are closed and we receive a lot of money in sales taxes. That revenue is gone. We depend on monies from the county and from the state and the federal government. And from all of the reports that we are hearing and understanding right now, we know that a lot of that aid and assistance, it won't necessarily be eliminated, but it will be greatly reduced. These are very real issues. And so, you know, in this past week, I've started having the public conversation about the fact that I'm working with my management team, our leadership team. We're working with the city council. We desire to work with the controller if we can get numbers from her so that we can really start looking at where we need to cut. We never hired any of the there are some open positions here in the city. So we're going to have to look at those. Are these nice positions? Are they absolutely necessary? And take a look at that. If there are vacancies in historic positions, if people are retiring, some of those positions might be lost through attrition. You know, clearly, we have union contracts that need to be negotiated. I don't see an increase. And that's one of the things that I said when I was running. Everyone wanted me to kind of commit to a number. And the number that I committed to, because I didn't have a full economic picture of the city, the number I committed to was 0 in the first year of my administration. And so that might be a promise that we definitely have to keep. Right now, we're focused on making sure that we are able to deliver the essential services that the city needs, that we'll be able to maintain the proper level of staffing that is required to do that. But at the same time, we have to be sure to cut expenditures because we're going to have reduced revenue. So just like people are making decisions in their houses as to what they're going to have to do to maintain their homes, the city government has to make decisions about what cuts we're going to have to make in order to continue to operate the city. This is a very difficult time, not just for Mount Vernon, but it's for everyone. Everyone is in this position right now. I participated in the United States Conference of Mayors call on Friday. I will be reaching out to the New York Conference of Mayors and some of the mayors in the region just to talk about how together, because this is not just going to be a Mount Vernon recovery, it's going to be a regional, a state, it's going to be a national recovery. But I can say this, one of the things that we need for the community to really focus on is because sales tax revenues are so important to Mount Vernon at this time, that we're going to have to put Mount Vernon businesses first. If you can go to a Mount Vernon supermarket, if you can go to a Mount Vernon store, if you can do shopping, we need you to shop Mount Vernon because that's going to help our businesses maintain jobs. It's going to help the city get sales taxes, and it's going to help the city be able to continue to provide essential services. We are already operating at a deficit when it comes to the number of firefighters that we're supposed to have. We are right at the line when it comes to police officers. Our staff is already stretched. So there are not a lot of deep cuts that we can make without making deep cuts to services. And so this is something that we need to look at. We definitely, through our transition team and now our advisory boards have convened and will continue to expand our conversations around economic resilience and development here in the city of Mount Vernon. That's a conversation that we started having when I was running. It's a conversation we've had constantly since I was sworn in, and now we have to continue to expand and deepen that conversation in the era of COVID. The only difference is I'm just glad that we're not in this by ourselves. There's a lot of conversation happening around the country about how communities are going to reopen and then what is going to happen based on the billions and trillions of dollars that have been lost in our economy across this country.
So with so what is your the conversation in regards to us opening? When do the schools open up, or are scheduled to open up in Mount Vernon?
So Governor Cuomo, New York is still under the pause order, and the pause order for the state of New York is scheduled to expire on May 15th. The governor is in the process of deciding if he will expand and extend that order, and he usually does it within a few days or a week or so before the date discontinues. I do not see us coming off of pause on May 15th, but I don't have the ability to make that decision. That's a decision for the governor to make. But we are paying attention to our numbers here in Mount Vernon and continuing to try to flatten the curve. With almost 3,000 cases, clearly this is a major issue in our city and in our community. Yes, we're seeing a decrease in hospitalizations, but as our testing center opens, we're going to see an increase in the number of cases only because more people are being tested. And one of the things I said on the last Sundays with Shawyn, or a Tuesday, Thursday update, is that we were not seeing a lot of cases in Leicester or Centennial Homes or Ebony Gardens. And we felt that's because people over there were not being tested. We are now seeing, with the testing center open right in that neighborhood, that the number of cases are increasing. So it's not as if the people were not infected. It's just that they did not necessarily have convenient testing available to them, and now they do. Coronavirus is not going away anytime soon. We will have to figure out how we move forward in light of it, but we have to be, and we will be responsible about how we reopen the community. We have to focus on a resilience plan for our community, and we will be requiring businesses to have what we call a resilience and a responsible plan. On Tuesday coming up, we will have some of our business owners on. They'll from the beauty salons, the barbershops, the nail shops, and we're going to talk about, what does business look like opening after, this long period of closing, and what are some of the best practices that they'll be putting in place? What are some of the best practices that the city of Mount Vernon and the state of New York will be requiring for these type of businesses? Last Tuesday, we had restaurant owners on the show. And so on Sundays, we'll be having these type of conversations and giving updates. On Tuesdays, we'll be focusing on our businesses and how our businesses are preparing for reopening. And on Thursdays, on our updates, we will kind of talk about the social and emotional wellness of the community. So we'll probably look this Thursday to have some clergy as well as some of our funeral homeowners on, because that has become a very big issue here. So we want to be able to provide the community with some emotional and spiritual guidance and understanding of how to continue to move through this as well.
So I noticed that there's been a lot of giving away of foods, essential thing that are needed. I want to give a quick shout out to Ken Bright from Progressive Services, who has been out there on the forefront giving out food. And volunteering has also been, Kevin Bunch has been out there volunteering. So shout out to him also. You have individuals from Mount Vernon giving back to the community. So when you first started giving out bags of food, what was the number in the beginning, and what is the number now?
Well, Mount Vernon has always had a pretty robust food distribution program, and we've definitely ramped it up. Tomorrow, between 3 p.m. and 6 p.m. at the Dole Center, we will be distributing grab and go food for the community. So if you come to the Dole Center, we will already have bags prepared. We will observe social and physical distancing. And let's start calling it what it is. It's physical distancing, not social distancing. Social is, more of the common sayings and phrases and talking to each other, but we will be maintaining a proper physical distance. We're delivering meals right now, homebound meals to homebound individuals in Mount Vernon, over 400 people, to over 400 people. And we are delivering meals for every day of the week. And they go out at least 3 times. So they usually bring meals for like 2 days at a time. And on Fridays, they bring meals for over the weekend.
How do you get on that list? How do you get on that list?
You would call 914-665-2420, 914-665-2420 for the homebound meals list. These are prepared meals that are delivered to people's home. All they have to do is heat them up. But that list right now, that list is full. We are accepting people on the waiting list. And we do check in on a regular basis with each of our homebound individuals. We have staff and volunteers who are calling them just to make sure they're okay, and do well care check-in visits with them over the phone, to ensure their social and their emotional and their mental wellness as well. At each of our food distributions, I know we have been serving 500, 600, 700 people as they come and pick up food. We've also been going to the different senior buildings, as well as the homeless shelters and some of the other vulnerable neighborhoods, to deliver hundreds and hundreds of bags of food each week. So I know here in Mount Vernon that we are definitely impacting at least 2,000 households a week through home delivered meals, through pantry bags. And that's the city of Mount Vernon and Feeding Westchester. Now, many of the churches are still operating their food pantries as well. Grace Baptist Church and a lot of the other churches, the Seventh-day Adventist churches, they continue to give out pantry bags as well. So we have graphics that we will continue to share and blast out that have a schedule. I mean, it's too many things for me to remember off the top of my head. But there are probably about 15 to 20 different organizations in Mount Vernon right now that are doing pantries, and some people will hit 5 or 10 of them. And that is to help underwrite the cost of their food. If you are unemployed right now, if you have reduced hours, we need people not to be too proud to say that they need help, because if you can save $25, $50 a week on groceries by going around and getting help from the different pantries, then that's money that you can utilize to help pay your Con Ed, your phone bill, your rent, and whatever it is that you need to do. So the grab and go distribution again is tomorrow at the Dole Center from 3 to 6 p.m. And it will happen until we run out of food. So from 3 to 6 p.m. at the Dole Center, you can come for a grab and go distribution. Our school district continues to do their grab and go meals Monday through Friday from 9 a.m. to 10:30 a.m. You can go to Parker, Graham, Trap Hagen, Benjamin Turner, and there was one more. Can't remember which one it was, but maybe we can look at it.
Now, so when individuals hear the word shelter, what comes to mind is that they're living in a place where they're unable to cook, and they attend or they frequent soup kitchens. So I know that Mount Vernon have a soup kitchen that's at the Armory. Is that still in operation right now?
No, that's not functioning because we can't have people congregating.
Gotcha.
They might do some food distribution, but they're not congregating as hot meals. In the month of March, we gave out 133,685 pounds of food. We served almost 1,500 children, 1,300 adults, over 600 seniors, for a total of almost 3,400 people here in the city of Mount Vernon. And so
That was
we
for
are.
March. That was for the month of March.
That was for the month of March. That was for the month of March. April's not done yet, so I guess when we finish tomorrow, we'll be able to get that information out. And that wasn't necessarily the hot meals; those were the pantries and grab and goes. So we know that YCOP was doing grab and go lunch and meals, like you said. Ken Brighton, Life Progressive Services.
Is YCOP still giving out?
Not right now. I know they might be looking to do it again, but they had to stop for a brief moment. And we will update the community if they're able to restart that. But
I
was
dropped
really
off
good.
I dropped some food off there one morning, early morning. I went grocery shopping and I picked up some hot dog rolls, a big bag of hot dog rolls and some hot dogs, because I was there at YCOP and I was able to see them in action with the children after school, which was a Wednesday when the governor announced that he was closing the colleges.
Yes.
That was the day. And then after that, everything just went downhill. But yeah, I was able to see them in motion.
So Malcolm has the graphic for the food distribution. Malcolm, can you put that up? It's the distribution graphic for where food is given out in Mount Vernon. And we will also put this up on our page and continue to share it on our page.
Because, like, you know, in the discussion of eating, right? And in eating, individuals have to make sure that they're also eating the right types of food while they have the chance to, and start becoming educated about what they're eating at the same time.
So if you can see, I don't know if you're seeing this, Cynthia, I mean, between Mount Olivet Church, the Church of God of Prophecy, Good Shepherd Church, New Life Fellowship, Mount Vernon Community Action Program, First Reformed Church, Grace Baptist Church, the Guidance Center of Westchester, Ridgeway Alliance Church, St. John Paul and Clement Church of the Ascension, Community Service Association, Bowen Memorial Church, Mount Vernon Seventh-day Adventist Church, Beulah Seventh-day Adventist Church, First United, and St. Mary's Pantry. These are all pantries. And this is a graphic that we continue to distribute in the community, and we will continue to post. And we have the phone numbers and the locations and the days of the week and the times for each of these sites. But you have to call and confirm with each of these locations before just arriving. And so again, the food locations for the school district, they have updated them, are Hamilton School, Graham School, Benjamin Turner School, and Trapphagen. So these are in each of the quadrants. Hamilton covers the West End, Graham covers that Heights section, Benjamin Turner Middle School, the South Side, Trapphagen covers that North Side. So these are the places where people can go and get food and get assistance. But please always make sure with the different pantry locations that you're calling before you go.
Sure. What are the do they have New York? You know, I work in New York City Department of Education, and we have schools that are open for essential workers.
Yes.
So for your police officers, et cetera, and so forth, we have specific hubs where teachers are there teaching those children whose parents have to go to work, and the nurses and doctors. Do we have that here in Mount Vernon?
We do. So the Mount Vernon City School District and the County of Westchester have partnered, and they are providing not school, but they're providing daycare for essential workers over at Holmes Elementary School. And so that is where the school district has classrooms open, and they're providing childcare and daycare to the essential workers' children here in the city of Mount Vernon, because they have to go to work and we
Right.
cannot put their children at risk by leaving them home. So I want to just hit another question that we have here. It says, I don't like the way the CDC clears people to go back to work by filing a form. Do you think another test will be more efficient to be certain if you're ready to return to work? So, you know, the protocols have changed around return to work orders over and over and over again. The testing is
Return to work orders after what, Sean?
after a person. So if a person is COVID positive and they've been home you know, for a while, and they've gone through all of their symptoms, the generally accepted practice right now in the state of New York, at least, I'm not going to speak for anywhere else, is you can return to work after your symptoms have been gone without any assistance. If you don't have a fever, no coughing, any of the symptoms that you had personally been displaying, for at least 72 hours. So you have to be clear of all symptoms and sickness and illness and temperatures for at least 72 hours before returning to work. This individual is asking if a person should wait until they test negative. Well, it's very hard to get a second test. And you know, even testing negative, it would be nice that in a perfect world, we would want people to be able to get a second test and they can go back to work based on that. But we do have people who have come back to work who have not been able to get a second test because we followed the CDC and the State Department of Health's guidelines right now, and we have not seen a spike of reinfection or them infecting anyone else. So there are still a lot of questions that have to be answered by this, but I would say about 90 to 95% of our essential workers who were infected and stayed home and went through the course of COVID and then waited those 72 hours. Some have waited even a week before coming back to work. They are back on the job. Michelle Yant Terry is one of our sergeants. Our Sergeant Michelle Yant Terry was highlighted on News 12. Like she said, she stayed home for over 16 days and she's returned to work and she's happy to be back at work. We haven't forced anyone to return to work or anything like that. A lot of I'm grateful to our first responders and essential workers because many of them understand, well, many of them want to come back to work. They wanted to do the jobs that they took a pledge and an oath to do, and they want to make sure that they are a part of the community's restoration, resilience, and our ability to move forward. So the guidelines, like we said, on returning to work have been changing and have been evolving, but we definitely do follow those guidelines. Some people have been able to maintain and get a negative test result before coming back, and others haven't been able to get an appointment for a second test, but they are following the protocols. But we do clear people through our HR department and through different departments before having them return to work. One more question. It says, will late fees and penalties be charged for taxes due for the city of Mount Vernon? No. The city council already passed the legislation saying that they were going to forgive late fees and penalties for taxes, not only for this year, but going back for several years. We want people to understand that penalties and late fees, not just for the 2020 taxes, but 2019, 2018, and going back a few years. And the city council will be releasing some more information to the public on that to make it clear. So penalties will be waived for late taxes in the midst of COVID. So hold on, here we go. So Malcolm said we have some other questions. Malcolm, I need you to put the questions in so I can read them. And everyone, please share.
While Malcolm is coming up with the questions, I have a question.
Mm-hmm.
So, yeah. So I know that today is Sunday. I think yesterday was the first day to start fasting for Ramadan? Correct?
No, that was on, so Ramadan started on the 23rd. That was April 23rd, and it goes to May 23rd. So, Ramadan Mubarak for all of those who are celebrating. And we wish you a blessed, a prosperous Ramadan season, and may your family and your homes and your spirit be enriched and blessed during this season of Ramadan.
And so are you participating? Are you trying to fast?
Yes, I am. I'm a Christian, but I am observing Ramadan. I definitely wanted to gain a greater understanding of the season. But I can tell you, in January, I had a hard time doing the Daniel fast as I was coming in to office, and there was just so much transition. And then I had started fasting during the Lenten season, and then we got hit with COVID. And so, as a person who is understands that the foundation of my life is my faith, I definitely feel with all that's going on, and not only in Mount Vernon but in the world, that I had to strengthen my spiritual ties and so I am fasting during this season of Ramadan.
Okay. All right. So I just want to one more time just want to make sure that that our individuals who are watching, our listeners, that we care about you, and it's very important that you take care of yourself, and that you replenish yourself the correct way, especially with you being inside. There's no such thing as, well, I can start when I go back to work tomorrow. You could actually start today. And so when you go to the grocery store, you're making sure that you're picking up a lot of fruits, a lot of vegetables, your citrus. Try to start, making sure that your children are inside and that they are eating healthy. And so picking up a bag of halos and them having an orange a day. The other day I spotted some pink.
Yes.
I wish I should have went to the refrigerator and show you a pink. It's the inside of the lemon is pink. So I know it's a
I get to break fast after this show.
Excellent. Your citrus is very important. Your
Yes.
grapefruit, your lemons, your pineapples, because you want to make sure that your immune system is that you boost your immune system, your natural immune system. Very, very important, especially during this time. And as well as getting out and taking a walk. So you can go out and take a walk. And the floral arrangements around Mount Vernon are absolutely beautiful. The other morning, I spotted a snail. I saw a woodpecker. I spotted a blue jay. I saw, I just,
So Cynthia, you're a teacher, and the 50th anniversary of Earth Day was last Wednesday or Thursday. And Cynthia gave me all of the materials and all of the equipment to make my plan in the jar. You gave me the mason jar, you gave me the rocks, you gave me the soil, you gave me a lemon balm plant. So, we're thinking so much about sickness and death, but like you said, the earth is waking up. This is the spring. And so in the midst of all of this stress, hopefully people are taking a moment to recognize the beauty around us. So we have a question. Silk Parker says, my question is, why aren't they retesting all that have tested positive? Basically, they're playing Russian roulette with people's lives. Is that people don't know if the virus is completely gone after having it? So, like we said, this is something that is very new. These are CDC, these are Department of Health regulations and mandates. What we've heard from the very beginning is that test kits are low. And so right now, test kits are being used to focus on helping people to confirm whether they're positive or not. So at least they know what to do. What we've told people, if you're experiencing symptoms, if you feel like you have been exposed, then you need to act like you are positive and start doing all of the vitamin C dosing, isolating yourself from your family members in your house. And you don't have to just wait to get your positive. result to start changing your behaviors and making sure that you are taking care of yourself. You're drinking the hot teas. You know, if you have a fever, take your Tylenol. You don't have to wait to get your test result. You can start those medical interventions and reaching out to your doctor as soon as you realize that something is different and something is shifting. A lot of people are saying, well, I don't know if it's my allergies. Look, err on the side of caution. Err on the side of caution and reach out and make sure that you get yourself a test, especially if you're running fevers, you're dealing with body aches and things of that nature. We want to make sure if you're living in the house with people that you're isolating yourself and you're protecting your loved ones as much as possible.
So,
We're seeing
at
a lot of
first,
multiple people in their own households being infected, and that's because we're not isolating from family when we start to feel sick.
but so at first, were you allowed to just walk in and get tested? Was it like that in North Shore? Could you just go on Glen Island and because you was a North Shore resident and just go there and say, you know, here's my ID, I'm a North Shore resident, I want to get tested?
These state testing centers, you always had to make a phone call and have an appointment. They couldn't just have people showing up in mass. And even now, because you know, in the region, over 35% of the people who are testing positive. And that's because they do have limitations on who can come get a test. If you just say, oh, it's Monday and I think I want to go get tested, they're not going to just test you for that. That's why I say when you call, they screen, you know, do you have a temperature? What symptoms are you experiencing? Have you been exposed or been around someone who's tested positive for COVID? Because the test kits themselves are in such short supply that you can't just test everyone because they want to be tested. Some of the other testing that they're doing right now also are antibody tests. And so they're doing antibody tests in the parking lots of like grocery stores. So they were doing antibody tests in the parking lot of Food Town. And when you get an antibody test and you get the results from that, if you've developed antibodies for COVID, then that kind of lets us know that you've been exposed or you've had a case of COVID. So there are some people who are being tested on the front end, and then there are other people who are finding out that they've been exposed to COVID and they've developed antibodies on the back end. There is still so much to be known about this, but what we do know is that we need everyone to use universal health precautions and act like anyone and everyone that you're around is potentially a source of infection. So when you're outside of your apartment or your house, put on your mask, use your mask. If you need to use your gloves, use them. Continue to be physically distant from people and make sure that you are observing proper distancing because we want people to be safe. This is not going away right away, Cynthia. Hold on. It says, when is alternate side parking going to take effect? Right now, alternate side of the street parking is still suspended. It's still suspended because people are still home and the community hasn't opened back up and the schools haven't opened back up. But there is a cost to the convenience of having alternate side of the street parking and parking rules being suspended. The cost is that the city is losing hundreds of thousands of dollars in parking revenue and ticket revenue, but then also we're not able to get our street sweepers through to sweep those blocks. And so we're asking on residents, on business owners and businesses that are still open, if you're sweeping the front of your house or your business, do not sweep the garbage into the street and into the gutters of the street. That is just allowing garbage to build up. So we're asking if you're sweeping the front of your business or the front of your house, that you're collecting that garbage, that you're putting it in a bag so that DPW can collect it. Your gloves and your masks, don't throw them in the streets. The more things that people are throwing in the streets or people are sweeping in the streets, it's just going to go down into our sewers, and our sewer system, we already know, needs a lot of repair. So we need everyone to do their part. Everyone asked us to suspend alternate side of the street parking because there was just nowhere to park. We've done that, and now we are asking for the residents of our community to help us maintain the cleanliness of your neighborhood and the cleanliness of your property and the properties around you. This one hand has to wash the other. This is something we're experiencing, things that are unprecedented that we've never experienced. People were hoping the shutdown lasted for a week or 2 weeks. We might still have several weeks to go of this. And we really shut down around the 16th, 17th of March. So we are 5 weeks into this, and we might have several weeks to go. So we need everyone to do their part and help, and not just sit back and criticize what they feel is not being done, or say what they feel should be done, but be a part of the solution and not just talking about it. Oh, and Malcolm said, so my nails are still busted. I'm gonna probably soak them off and do my own home manicures. I need some color, but me, like everyone else, I've told people, I said that our life is more important than our vanity right now. And so a lot of people are saying, open up the nail salons, open up the beauty parlors, open up the barbershops. It's just not that easy to do. We are still losing people. I've had friends on Facebook in the last few days still talking about the fact that they're going in the hospital, that they're being hospitalized. We are still seeing rest in peace and sleep in peace. We're still seeing virtual and Facebook Live funerals and motorcades. This is not over. So while we're still talking about looking at opening up, we still need people to focus on the fact that contagion is still spreading and that everyone has to do their part to help stop this. 2 pending questions above. Malcolm, am I getting all of the questions? Hit me in this chat box so I can see if I'm getting the questions. I answered them. Okay, so I've answered the questions that are out.
Share.
Yes.
Okay, so the educator that I am, I'm going to also add it to the chat, right? So there's 2 free download children books. They're ebooks, and both of them are about the coronavirus.
Okay.
One is where children are asking questions back and forth, and they're breaking down, about the coronavirus. They're also breaking down things that you can do while you're at home. And then there's another book by 2 doctors, and it's about, the title of it is Why We Stay Home. It's by Dr. Samantha Harris and Devin Scott. And it's about Susie, who is so happy that everyone is able to stay home, but her sister explains why they are staying home together right now. And so it's really cute and it's free. And I know that everybody is doing a lot of online reading and online learning. And so I will add it so that the listeners can download it for their grandchildren or for their children, godchildren, and pass it on to one another.
So what's important, and I just pulled it up, people can go on the sesamestreet.org. So Sesame Street did put out a Caring for Each Other town hall to really help our children understand, because a lot of the small children, they are having a hard time understanding why they have to stay inside, why they're not going to school, why they're not going to daycare, why mommy or daddy might have to stay in the room and they can't see them. We had Detective Dave Clark on the other day, and Dave has been in quarantine now for 3 weeks in his house, and he has a 2-year-old, and so Dash wants daddy, but he can't have daddy because daddy doesn't want to potentially expose his son to coronavirus. So, this is very different. This public health crisis, this incident is different from anything that we've ever seen. I've spoken to so many people who are really overwhelmed because as their loved ones are in the hospital or as their loved ones are in nursing homes, you cannot go visit. You cannot visit in the hospitals right now. You cannot visit nursing homes. And when people are in nursing homes and their families are used to visiting them and this has stopped, it's very difficult. It's challenging mentally, it's challenging emotionally. And I've spoken to families who are very angry. They're angry because they're saying my loved ones are missing me. They're confused. They might have dementia. They don't understand why I'm not there. I really need to get in to see my family members. And at the same time, it's very, very different on our healthcare workers, difficult on our healthcare providers. Why? Because they're not just providing the physical health care that they usually do. When I got a double knee replacement last year, my family was able to come and see me. They brought me food, they helped me get dressed. They helped me do some of my exercises. They helped me to take care of some of my personal activities of daily living. And now families aren't able to go in there. You saw many families in there washing and helping with hygiene and keeping them socially and emotionally and mentally motivated and connected. And because families can't go in now and do that, all of that falls back on the hands of the staff, who themselves have been testing positive, getting sick, going out, coming back to work. So this is a really difficult and a very different situation than we've ever experienced. We're dealing with an uptick in domestic violence, not just here in Mount Vernon, but across the county, the state, and the country. Because people are home and they're overwhelmed, and people are antsy. They want to get out. People are worried about the future of their finances and their families and how they're going to take care of their families. Over 26 million people have applied for unemployment, and the economic projections right now are going to be that this is going to look like the Great Depression. So we felt that we dealt with a recession back in 2008. They're predicting right now that this is going to be far worse than that, and that the unemployment rate nationally within the next few months is going to exceed 20%. So this is not a local issue. We're going to feel the impact locally, but this is a national and an international issue. And this is the time, as never before, for us to put aside petty differences, political agendas, and whatever might be involved, because it's going to take a lot for our communities to recover. We want to hear productive voices and productive conversations. We want people's input, and if so you have expertise in something, please send us an email at mayorsph@cmvny.com, or send information. We don't have all of the answers. We don't pretend to have all of the answers, and we want the expertise of this community and the involvement of the community, because that is the only way as a community that we're going to truly be resilient and come out of this, is if we work together. And so my old campaign slogan, "Forward Together," is not just a campaign slogan. It is a necessity. It is a mandate. It is a command. It is a charge for us to, in a united, intentional and strategic fashion, to move our community forward together, because we're not going to do this individually. This is not the time for political posturing.
There's a couple of individuals who dropped some information. So one, Linda. Hey, Linda, how you doing? I don't know who Linda is, but hey, Linda, how you doing? Linda said that the Guidance Center of Westchester is no longer has any food at the food pantry.
Okay.
They no longer have a food pantry. Also, there's a question here. Are you ready for the question?
Yes, ma'am.
Have you received any information from Montefiore about keeping Mount Vernon Hospital open? That question is from Zena.
Well, right now that conversation has been suspended. I mean, we are still under the state of emergency. We do anticipate, based on all of the conversations that we hear coming out of Washington, D.C., and even out of our state, that we might be looking at another wave of COVID happening in that September time period. So right now, that's not a discussion that we're having about closing the hospital. I did have an initial conversation with the president and CEO of Mount Vernon, Montefiore Mount Vernon Hospital, and we are saying we are coming back to the table with fresh eyes to have a conversation and look at the needs of this community and what the data is saying and where that leads us. So he wasn't in place when that decision was made. I was not in that place when decision was made. So we are two people who will continue to come to the table, but we absolutely want top quality comprehensive medical care here in Mount Vernon. And we do have the support of our federal, our state, our county, and our city of Mount Vernon officials. And so that is not a fight that is over. We continue to have those conversations. There is a question that was asked about whether or not they're hearing Governor Cuomo speak about summer schools in different communities, and will Mount Vernon have summer school? So these are conversations that are definitely being had right now by the Board of Education and Dr. Hamilton. There are just so many questions that are remaining as to how schools will reopen. It's not just a local issue, it is a national issue. When your classes are designed for 20 kids and we already have classroom overcrowding in a lot of our schools, how do we reconfigure those classes and how do we schedule the kids so that we can have the proper physical distance? Desks are not 6 feet apart.
I don't think if they do have summer school, I doubt summer school will be physical. I think summer school will be virtual learning. And that is because it's too risky right now to put ourselves out there. Children cannot be out there like that, and adults. So we have to think about exactly how this is going to take place. It's just too many at one time convening at the same time without things in place. So I think most likely it will be summer school, but the summer school will be held virtually. That's what I think. And I apologize for that because, the children are going through really rough patches right now. I don't call it post-traumatic stress disorder. I think it's constant current stress disorder. And the children are really feeling it right now. We have teachers, shout out to teachers who are doing drive-bys, driving through the neighborhood and decorating their car and telling students that we miss them. It's so much that is going on. And yeah.
And I know, people are asking questions about graduations. I was speaking to a teacher yesterday and she said she would love to see some type of drive-by graduations coming, whereas the kids showed up, they stood in front of their school, they were given their diploma and they were able to take a picture just to have some type of memento, but different things, creative things are being done. So we have to wrap this show up now. I want to thank you so much, Cynthia, for coming on and adding to this conversation. And I just want to make sure that we kind of go back to the beginning and just give some of the points. Mount Vernon right now, we are at 1,940 cases as of Saturday. We believe there are at least another 900 cases based on the county's cases where they don't have addresses. So we're assuming we're 10 to 11% of those 9,000 cases. And then for every case that we are aware of, there are cases that we are not aware of because people have not been tested. If you have complaints, if you have concerns about compliance from businesses here in the community, they're not wearing masks, they're not wearing gloves, they're not following CDC guidelines around social and physical distancing, they're not sanitizing the stores properly, please reach out to the Mount Vernon Police Department at 914-665-2521. 914-665-2521. If you have price gouging concerns, not that the price went up a little bit, but that the price is just ridiculous and out of sync with anything you've ever seen, you can call our Office of Consumer Protection and Affairs. That's the Office of Consumer Protection and Affairs here in the city of Mount Vernon. And that number is 914-665-2433. 914-665-2433. We will see prices in our meats start to increase as meat packing plants around the country are closing because of widespread COVID exposure in those plants. So, there are certain things and inevitabilities we're going to have to plan for, but we want to make sure that people are not price gouging. And so we look back up through the supply chain and make sure that some of the increases that we're seeing are legitimate, and if they're not, we are pulling them into compliance. If you are experiencing symptoms of COVID and you're interested in getting a test, Mount Vernon does have a testing site here at the Mount Vernon Neighborhood Health Center at 107 West 4th Street in Mount Vernon. And in order to get an appointment, because you can only be tested by appointment only, you would contact 1-888-364-3065, 1-888-364-3065. And tomorrow we will have our grab and go pantry distribution at the Mount Vernon Dole Center. Mount Vernon's grab and go pantry distribution at the Dole Center. And that will be from 3 p.m. to 6 p.m. And food is available while supplies last. I recommend that if you can, come out early. Don't wait until 5:30, 5:45, 6 o'clock, and then be angry because you're getting what's left. If you're working, send a family member, send a relative, send a neighbor, send a friend to pick up your food. The grab and go lunches are still available through the school district at Benjamin Turner, at Hamilton, at Graham, and at Trap Hagen School Monday through Friday from 9 a.m. to 10:30. And last but not least, as we close out, I am once again going back to the caution that we gave people who live in apartment buildings. Remember, an apartment building has a lot of common areas, and you have to continue to practice proper hygiene and proper personal protection, even in your building, whether you're in the halls, the laundromat, the elevators, the stairwells, the lobbies, common rooms, fitness centers in your apartment buildings should not be open. It's not just public gyms, but gyms that are in your apartment building should not be open. And if you do not feel that your landlord or the staff is cleaning and sanitizing the way that they should be, I definitely encourage you to call and make a complaint to the management companies because they should be cleaning and sanitizing the building properly. And if you are riding on the elevator or anytime you are outside of your apartment, within your apartment building, you should definitely be wearing a mask and wearing your gloves if they are available. So Sin, again, I just wanted to say thank you so much for coming on. Thank you for being a part tonight. And everyone, thank you so much for your questions. God bless Mount Vernon. And we will be back on Tuesday at 7 p.m. And we will be speaking to some of our business leaders who own beauty salons, barbershops, and nail salons and other personal care businesses. So we can have a conversation about what them opening up would look like. What are some of the changes that they're going to make to protect them and to protect their customers from being exposed unnecessarily to COVID. Everyone, thank you. Have a blessed night and take care.
Bye-bye.
Bye.